Upper limit is the hairline, below is the chin. Then the mandible, that is the lower border of the mandible, you know. So this is the lower border. So this is the upper limit and this is the lower limit. Anteriorly the midline and posteriorly we know the tragus, that is the ear, that is the tragus. So that is the location of the face. How do we dissect the face? We put a vertical line from the temple up to the root of the nose. Then we keep a curved incision around the eyes. Again, we will meet at the midline and it will go down, and again we have to deviate around this is the L of the nose. Again we have to come down through the midline, that is the upper labial margin of the lip, and here again we will make another circular incision and ultimately we will reach here. From here we will make an incision up to the upper limit of the ear. From the angle of the lip, another incision is given up to the tragus and around the lower border of the mandible, and skin is reflected. Now, what is the importance of the face? Face has got only the superficial layer, that is superficial fascia. There is no deep fascia. If there is a deep fascia, what will be the problem? There will be a hindrance to the facial expression. The face is for facial expression, and facial expression is needed for verbal or non-verbal communication. Non-verbal communication. Okay. So there are several muscles in the face. They may originate from the bones, but ultimately inserted over the skin or the superficial fascia. So there are several impression or expression that is showing of annoyance. So there is a corrugator just above the superciliary muscle. Okay, we can close our eyes. There is one muscle. We can open our eyes with the help of another group of muscles. We can close our mouth. Another set of muscles. We can open the mouth with another set of muscles. So, what is the benefit of absence of deep fascia? Benefit is, if there is deep fascia, there will be no facial expression, hardly any facial expression. But what is the disadvantage? Any infection in the face can spread inside, especially through a vein which is called the facial vein. And that facial vein is connected with the intercranial veins. Intercranial veins. And the veins which are in relation to dura mater, like cavernous sinus. And also there is around the pterygoid process of the sphenoid board, there is pterygoid venous plexus. So it may enter into the deeper layer and it can reach the meninges, and that can lead to meningitis. And the facial vein has got no valve, so it can move in either direction. It can move on the superficial direction, and it can move on the deeper. It can, from the superficial vein, the blood can enter into the deep veins, and through the emissary vein they can enter. There is a communication with the dural venous sinuses. Most dangerous one is the cavernous. You will know gradually there is a cavernous venous sinus which is present at the base of the skull, which can lead to cavernous venous thrombosis, and it's a life-threatening condition. Meningitis, cavernous venous thrombosis. So this is, and at the same time, the facial vein is very thick. So when it is cut, it will not collapse. So it will remain open with the exterior. From the exterior, infection may enter into the vein and it can go into the deep veins. And another disadvantage, if the venous wall is thick, it will not collapse. It will remain open. So what is the disadvantage? If the vein remains open, what is the another disadvantage? From air will enter into the vein, that is called air embolism. So that is the peculiarity and some danger areas of the face. Which one is the danger area of the face? What I was saying? I was saying about the vein, facial vein. You can see this vein is formed by two veins at the medial angle of the eye. There is a supratrochlear and supraorbital vein. And ultimately we get at the medial angle of the eye, okay, we can get this formation of this vein, and that is the angular vein, and ultimately it is continued as the facial vein or anterior facial vein. So it has got so many connections. You know, there is inside there is a cavernous, what I was saying, there is a cavernous sinus. So it has got connection with the cavernous sinus. Okay, so through there is one vein which is called supraorbital vein. Okay. Superior ophthalmic vein, through which it is connected with the cavernous sinus, and through the deep facial vein it is connected with pterygoid venous sinus, and which is in turn it is connected with the cavernous venous sinus. So that is the danger of the face. So there is a chance of spreading of this infection. So that is the danger area of the face. That is the nasal upper lip, nasal septum, ala of the nose. This is the area which is the draining area of the facial vein. Okay. So that is very important, and that will come in your examination. What is the danger area of the face? Dangerous area of the skin. Below the skin, only superficial fascia. Below it, we will get several muscles. Okay. The muscles like you can see one group of muscle is around the eyeball. Okay. Here we can see one group of muscle, and another group of muscle is around the mouth, opening of the mouth. So that muscle which is around the eyes, that is called Orbicularis Oculi. Oculus means eye. So that muscle is called Orbicularis Oculi. And another group that is called Orbicularis Oris. This Orbicularis Oculi, it has again several parts like orbital part, palpebral part, lacrimal part. Okay. Orbital part from the orbit of the, what is orbit? This is the orbit or the orbital cavity. So it is around, it is attached, the orbital part is attached around the orbit. Palpebral part means around the eyelids. It has got origin from medial side and it rounds the eyeball and again ends in the medial side. That is the medial palpebral ligament of the eye. It takes origin and it rounds the eyeball and ultimately ends in the medial palpebral ligament. And another is deeper one is the lacrimal part, which is at in relation, close relation to the lacrimal sac. Now, this muscle and this muscle, they have got some intrinsic muscles and they have got some extrinsic muscles, because we can show our different expressions with the help of these extrinsic muscles. You can see these are the extrinsic muscles, and within the and around the mouth or around the eyeball, that is the intrinsic muscle. What is the function of the and what are the different names? Like you can see here the extrinsic muscle, that is the zygomaticus major. You can see this is the zygomaticus major, zygomaticus minor, and also we can see one muscle is here which causes elevation of the lip, upper lip. So that should be named as levator labii superioris, and also it is related to attached to the nose, alacrinae. So around the ala of the nose, so this is the levator labii superioris alacrinae. মনে থাকবে? Levator labii, মানে the function of the muscle is elevation of the lip. So levator labii, labia means around the lip. Levator labii alacrinae. And another group of muscle is also attached here. Okay, you can see just lateral to it, the levator labii superior is alacrinae. One muscle is lateral to it. That is called, again that action is elevation of the lip. That is levator levi superioris. Another muscle. So one is levator levi superioris alacinazi, one is levator levi superioris. And lateral to it we can get another muscle, or it is in a deeper plane, that is the levator anguli oris. Levator anguli oris. That is the elevation of the angle. Levator anguli oris. So similarly, we can get another group of muscle which is depressor anguli oris, depressor levi inferioris, and most medially we can in the mid around the midline, that is the mentalis muscles. These are all extrinsic muscles and attached to Orbicularis Oris. And in another muscle we can see, okay, from the neck we can see there is a superficial, that muscle is present just below the skin, which is subcutaneous muscle. Okay, that is called platysma, and that is continued in the face as rhizorius. Okay, so we can find also the rhizorius muscle. That is the continuation of the platysma group of muscle. Okay. Remember the platysma, because I will tell you about the nerve supply, then you will understand. So, another muscle on lateral part, on the cheek, we can get, that is called the Buccinator muscle. On either side of the cheek, there is a Buccinator muscle. The person who are the trumpet players, what they do? They can make a pop, and that is contributed by this Buccinator muscle, and also it helps when it contracts. Okay, the area between the gum and the cheek gets compressed. So that is the Buccinator muscle. So when the Buccinator muscle will get affected, food material will get lodged inside. That area is called the vestibule of the mouth. Okay, so that is the Buccinator muscle. And that Buccinator muscle has got again several fibers. Okay, I am not going into the up to that level, because some superior part, inferior part, intermediate part. Okay, so there are several muscle fibers. We are not interested. So this is the origin and insertion of the muscle. So here we can see. So we can see this is the Buccinator muscle, and this is the platysma, this is the rhizorius, and this is the levator levi superioris alacinazi, Zygomaticus minor, Zygomaticus major, and this is the Orbicularis Oculi, Orbicularis Oris, depressor anguli oris, depressor levi inferioris, and mentalis. And also here we can find another muscle which is present within the forehead area, that is on the frontal area, there is a frontalis, and it is also connected with occipitalis through aponeurosis, that is called epicranial aponeurosis, or that is also called gallia aponeurosis. Gallia means helmet like. So there is a aponeurosis here, that is the Gallia aponeurosis. So they are connected with the frontalis muscle and occipitalis muscle. They are connected with each other with the epicranial aponeurosis. So this is as a whole called fronto-occipitalis group of muscle. All these facial muscle, you can see it here. All are, and also you can see the muscles around the ear. Some is in front, okay, some is above, some is behind. So auricularis anterior, auricularis superior, auricularis posterior. All these muscle. Just remember, this muscle takes origin from the platysma sheath, that is the platysma. Ultimately it migrates towards the face, and the nerve for platysma sheath or all these muscles of facial expression is the facial nerve or seventh cranial nerve. Because at this level you do not have some idea about the development of head neck. There are some arches which are called branchial arches. First, second, third, fourth, fifth, sixth. Okay. Just remember, these muscles are a part of the second branchial arch. The first branchial arch is the muscles of the first branchial arch are being supplied by the mandibular nerve, and the second arch is supplied by or hyoid arch is supplied by the facial nerve. So all these muscles are developed from the second branchial arch. Okay. So ultimately the nerve supply is seventh or facial nerve. Forget about the branchial arches. Okay. If it is very much cumbersome or anything, at this moment you can erase. But afterwards you have to know. Okay. Now the nerve supply of the face. What we can see is the hand. Hand has got so many fingers. So fingers represents the different branches. That facial nerve, the face is supplied by the facial nerve. Okay. And the facial nerve, where we can get it? Within the parotid gland. It comes out through the stylomastoid foramen. And ultimately it will enter into the parotid gland. Parotid means around the ear. Par means around. Otid means ear. So around the ear we can get one gland, that is called parotid gland. So within the parotid gland it divides into several branches. Upper two branches, lower two branches. Okay. And ultimately when they are coming out from the parotid gland, we can get 5 branches. Or like this, 5 branches. This is the branches. This is the branch which is supplying the temporal region. Okay. It should be like this. The temporal region. So that is the temporal branch. One is going towards the zygomatic bone. This is the zygomatic bone. This is the temporal bone. So temporal branch, one is going towards the zygomatic bone, so that is the zygomatic branch. One is going towards the cheek, that is called Buccal branch. One is going towards the mandible, that is called mandibular or marginal mandibular branch. And one branch is going down, that is called cervical branch. Okay. So we can get the extracranial part of the facial nerve. Okay, only the extracranial part of the facial nerve. Facial nerve we will know as a whole, the origin, several nucleus of origin, course and everything we will know later. But here what we can see when it is coming out through the stylomastoid foramen. Another two branches are missing here. Okay. Here you can see when the stem of the nerve is coming from here, another nerve is coming and it is going back. This is called posterior auricular branch. It supplies these muscles, the auricularis posterior and also the occipitalis muscle. Okay, and this is the facial nerve from where we are getting temporal branch, zygomatic branches. Then we are getting the buccal branches. These buccal branches is again upper and lower buccal, marginal mandibular and the cervical. Again, if you want to know in a the superficial or in a depth, that knowledge is one is this is superficial knowledge. One is the knowledge which remains within the depth. That is actually you can see the buccal branch. Buccal branch has gone what? Superficial buccal, deep buccal branch. The deep buccal branch is divided into upper and lower buccal branches, and they are in relation to the parotid duct. One is above the parotid duct, so upper buccal branch is above the parotid duct and lower buccal branch is below the parotid duct. One is going towards the mandibular area, that is the marginal mandibular branch, and this is the cervical branch. Face is supplied by, there is only the facial nerve is for facial expression. That is a motor nerve. What about the sensory nerve? The sensation is carried out by the trigeminal nerve. Okay. Trigeminal, that means fifth cranial nerve. Seventh cranial nerve is for motor action. Okay. And fifth is for generally for the sensation, except the mandibular branch, because mandibular branch supplies the muscles of mastication. Okay. It has got motor component also. So here we can see so many branches. These are the branches we can get, and there are, you can see some area of division. You can see this area, it is within the catchment area of the ophthalmic division. This is the area bounded in between two dotted lines. This is for the maxillary division and this is the mandibular division. So you can see so many branches that like supratrochlear, supraorbital, infratrochlear, external nasal, and also there is one that is missing. There is the lateral palpebral branch that you cannot see. So there are altogether 5 branches from the ophthalmic division, 3 branches from the maxillary division, that is infraorbital, zygomatico-facial, zygomatico-temporal, and from the mandibular division we can get auriculotemporal nerve, buccal branch and mental nerve. So 11 branches from the trigeminal nerve, 5 from the ophthalmic division, 3 and 3 from the maxillary and mandibular division. They are basically for the sensation, to carry out the sensation. and the angle of the mouth. This area is not been contributed by the trigeminal nerve, but it is contributed from the cervical plexus, which is called the great auricular nerve, which is called great auricular nerve. So this area is supplied by the cervical nerves. So that is the great auricular nerve. Okay, except that angle of the skin over the angle of the mandible, that is being supplied by the cervical plexus. Otherwise, the face is being supplied, the sensory supply definitely by the trigeminal nerve or fifth cranial nerve. And there is a communication between sensory nerve and the motor nerve. Where we can get? There is a reflex action. If something is put inside the eye, suppose a hair or any foreign body, there is immediate blinking of the eyes. So there is a blinking reflex. So sensation is carried out through the trigeminal, that is the ophthalmic division of the trigeminal nerve, and motor, that is the, it is by the facial nerve. Zygomatic branch, palpebral branches are there. So there is immediate reflexly there is closure of the eyes. Okay, so that is a reflex action. So these nerves are very much they are in close proximity, the sensory nerves and the motor nerves. Okay. So that is a trigeminal neuralgia, that is very critical situation, that the particular area of the face gets stimulated, the particular nerve or branch, like ophthalmic branch or any branch, maxillary or mandibular branch, and there is a severe pain, severe excruciating electric shooting pain. Immediate medication is needed. Okay, carbamazepine. There is one medication, that is carbamazepine, and it is not very uncommon. Even a famous film star, Salman Khan, suffers from trigeminal neuralgia. Okay. Okay. So about the facial artery, in the face there are facial nerve, facial artery, facial vein. Facial artery, it is coming out from, you can see the common carotid artery divides into external and internal. This is internal and this is the external. From the external carotid there are so many branches are coming, like superior thyroid, lingual. Then we can get the facial nerve, okay, a facial artery. Sometimes this lingual and the facial may come out as a single artery, which is called linguofacial artery. So this comes out, it comes in relation to the ramus of the mandible, and in between ramus and the mandible and the submandibular gland. Here we are getting the submandibular gland, and within it gets compressed within it remains in between the ramus of the mandible and the submandibular gland. And at the anterior body there is one muscle which is called the masseter muscle. From the anterior border of the masseter muscle, at the lower border of the body of the mandible, it hooks round and ultimately it is distributed in the face. And you can see this artery is tortuous. Facial artery is tortuous. Why? There is a facial expression. There is, and within the neck, there is when we are eating, there is the deglutition. So there is a movement of the mandible and movement of the larynx, and also the muscles of the neck. Okay. So to accommodate that movement, the facial artery is tortuous. But the facial vein is not tortuous, it is straight. Because the facial artery remains away, there is one opening that is called mandibular foramen. Here we are getting a mandibular foramen, and here also we are getting one mandibular foramen, that is the axis of movement. So it is away from the mandibular foramen, so there is a chance of wear and tear. Okay. So whereas the vein is towards, it is away from the axis, the artery is away from the axis, a vein is towards the axis. So there is no chance of wear and tear. So there is that it is facial vein is straight. So ultimately it divides into it gives so many branches, lower labial, upper labial branch, and ultimately it ends with supraorbital and supra. But কিছুই নয়. There is an anastomosis between this artery. This is an artery of, this is external carotid and this is internal carotid. Internal carotid will go inside the cranium, and ultimately there should be one anastomosis between external and internal carotid arteries. Yes, and here is the area where there is a communication between the external and internal carotid arteries. It actually, this artery, there is a, what is the anastomotic arteries? That is the dorsal nasal branches of ophthalmic artery. Within the eyeball, we can get one artery that will come out, and from here the facial artery will join with that artery, that is the dorsal nasal branch of the ophthalmic artery. Ophthalmic artery has so many branches like supratrochlear, supraorbital, so many branches, and there is dorsal nasal branches. So there is a connection between the internal and external carotid artery around the angle of the eye, inner angle of the eye. So this is the vein, supratrochlear vein and supraorbital vein joins to form the angular vein, which is continued with as a facial vein or anterior facial vein, and it is connected with another vein that is called deep facial vein with the pterygoid venous plexus and ultimately with cavernous venous sinus. So we can get another set of vein, that is the superficial temporal vein. Superficial temporal vein and maxillary vein joins to form retromandibular vein. Have you seen any vein which divides into anterior and posterior branch? Veins always joins and rejoins. There are so many tributaries. This is the only area where you can see a retromandibular vein. This behind the mandible, we can get this vein divides into anterior and posterior division. This anterior division joins with facial vein, which forms the common facial vein. Ultimately, it joins and it drains into the internal jugular vein. Whereas the posterior division joins with the posterior auricular vein to form the external jugular vein, which is very much apparent in the face around, over the sternocleidomastoid muscle, and that is the external jugular vein which drains into the subclavian vein. What is the clinical anatomy? That is the danger area of the face. Okay.